name on it. And right under that, it's going to have a series of letters and numbers. This is no longer going to be your Social Security number. If you have a card that has a Social Security number on it, you need to go ahead and shred it because that card is no longer valid. If you hand them that card at the doctor's office, basically it's not going to work because the numbers are completely different now. But this is what a Medicare card looks like. Some of them will have Hospital Part A. Most all of them will have Hospital Part A. Some will have Part B, depending on whether you took Part B or not. So what is Medicare? Medicare is a federally funded program. It's an insurance program that provides coverage for medically necessary procedures, medical supplies, and equipment. Kelly, can you go to the next screen or?
It's trying to.
Okay. So as she's going up, just go ahead and go to the next one too, because we've already talked about that one. So who is eligible for Medicare? Anyone that is the age of 65 or older who participated in Social Security or the Railroad Retirement System is eligible for Medicare. Employees of the federal, state, and local governments are also eligible, and their spouses. Sometimes the spouses stayed home and worked with with stay-at-home moms. If they had a spouse that worked and paid in, they would also be eligible under the spouse's benefit. If you are on disability and you have been on disability for a total of 24 months and you're younger than 65, you are also going to be eligible for Medicare. Those that are disabled due to Lou Gehrig's disease or ALS are also eligible. End-stage renal disease, there's some criteria on that, but if you're receiving dialysis, normally you get eligibility very quickly. Sometimes if you file for disability, it can take, 2 years, it can take 3 years before you are ever approved for disability, but they do backdate that. So sometimes you get your disability and then right after disability, you get a letter saying you're going on Medicare. So those are the people that are eligible for Medicare. The next screen. If you can remember these three things, when you turn 65, you start getting a lot of stuff in the mail. Most people are bombarded with information. People come to me all the time and say, oh no, I got this letter and it says Medicare, I have to respond right now. These three, of course, two of them are together. So the CMS, Department of Health and Human Services, and the Centers for Medicare and Medicaid Services, if you get stuff from them, it is from the government. So these are two, they're usually together. So if you can look for papers that have this on it, this will be something that you need to keep. Also, you'll get things from the Social Security Administration. They are responsible for your Medicare eligibility and enrollment, but the Centers for Medicare and Medicaid Services, they kind of administer everything. So if you are coming of Medicare age, if you can just remember, again, you get things from a lot of different people. So if you can remember these three things, the Centers for Medicare and Medicaid Services, Department of Health and Human Services, and Social Security Administration, if you get anything from those, you need to keep those documents. Okay, the next screen. So this is a big question that we get a lot. Do I need to enroll in Medicare Part A and Part B? And they'll come in here and say, well, what about penalties? What about these deadlines? I have to do this. There are penalties and there are deadlines for Medicare. If you are covered, let's say under the marketplace insurance or Obamacare, when you become Medicare eligible, you must enroll in Medicare. There are a couple of reasons where you would not have to, but other than that, you are required to enroll in Medicare. So a lot of the times people will come to me and say, but I only pay $20 for my marketplace insurance. And you're telling me that I'm going to have to pay $164 just for Medicare Part B. Yes, with those marketplace insurances, those people that are not paying a whole lot for it, they get a subsidy. If you are Medicare eligible and you say, I don't want Medicare, I'm going to stay on my marketplace insurance, you will lose your subsidy. And that subsidy is usually quite large, and you could be paying over $1,000 for that. So in that situation, 164 versus the over 1,000 would be a reason why, yes, you do need to go on Medicare. Medicare has deadlines, and I think that's a little bit further out in the presentation, but you have a total of 7 months to sign up for Medicare. So you have the 3 months before you turn 65, the month of, and 3 months after. If you do not sign up within that time frame, you could be charged a penalty. Of course, there are situations in which you would not be charged a penalty. But if you are 65 and you're not covered under any insurance other than the marketplace, then you do need to sign up during that 7-month period for Medicare A and B. Next slide. So automatic enrollment. If you are receiving your Social Security benefits and you are turning 65, your Medicare becomes effective the first day of your birth month, unless you were born on the first day, and it becomes effective the month prior to. So if you are 65 and you're already receiving your benefits, you will get your Medicare card in the mail 4 months prior to your birth month. Now, again, earlier I was saying that you get bombarded with mail. That Medicare card comes in a white 5x7 envelope with Centers for Medicare and Medicaid Services, Department of Health and Human Services on it. So those are two of the names that I said try to remember. The majority of the people that are already collecting Social Security, when I tell them they've got their Medicare card, they're like, no, I didn't get it. You do automatically. If you're receiving your benefits, you will get your Medicare card 4 months prior to your birth month. People under 65 who are entitled to Social Security benefits, once they have been on disability for 24 months, then they will also get a Social Security or a Medicare card in the mail. And the only thing about that, again, is if they have been trying to get on disability for 3 years, once they are approved, they do count that because they will back pay them. Most of the time they'll ask them, they may backdate their Part A, but the Part B, they will ask them if they want it to start the following month. So you do get enrolled when you have been on disability for 24 months. You do not have to take Medicare Part B. There's a little thing there that says beneficiary has the option to decline Part B. The only reason you would ever not want to take Part B would be if you were covered under an employer group health plan that has 20 or more employees through either yourself or a spouse. Otherwise, if you don't take it, you will be charged a penalty for that. So just remember, if you are born the first day of the month, your Medicare starts the month prior to. Otherwise, it will start the first day of your birth month. Even if you were born the 31st day of the month, it would start the first day of that month. Okay, the next screen. So initial enrollment period, if you are not collecting Social Security, again, you have that 7 months. So you've got 3 months before your birth month, the month of your birth month, and 3 months after. At any time, the 3 months prior to, if you start your Medicare, it will begin again on the first day of the month, unless you're born the first day of the month and it's the month before. If you start it the month of your birth, then it would begin the first day of the following month. And then anytime after the 3 months afterwards, it's the first month after you start it. So used to, it was not like that. That began January of 2023. But now, anytime you sign up after your birth month, it starts the first day of the following month. The next one. So general enrollment. So earlier I was saying that some people don't want to sign up for Medicare Part B because either they just don't want to pay the $164, they didn't realize it, they may have lost their employer group health plan and just decided that, you know, I'm healthy, I don't want to do it. If you wait 4 months afterwards, or if you're working and you wait longer than 8 months, you can sign up for Medicare during the general enrollment, which is January the 1st through March the 31st. If you have went without Medicare Part B and not had creditable coverage for 1 year, so 12 full months, you are charged a 10% penalty. Recently, I had a guy that just said he wasn't wanting it. He wasn't paying for it. And he came to me 10 years later. So he is paying a 100% penalty. So instead of paying $164.90, he's having to double that because he was healthy and didn't feel as though he needed the insurance and didn't want to pay it. So the penalty is applied for every 12-month period that you go without Part B when you should have been covered. So when you turn 65 and you don't want it, or if you lose your employer group health plan, you've got 8 months to get it, or the 3 months after.
And Denise, stop just a minute. If you have the penalty, it is added on to your monthly premium.
Correct.
Every month, correct?
It is added on every single month. So it's not that it's going to be for a year or 2 years. It is every month, as long as you have Medicare Part B. Yeah.
Thank you.
The next screen, I think. Is there any questions about those 3 things?
We do have one question, Denise.
Okay.
It's if you work past age 65 with an employer paid plan, is there a penalty?
There is not a penalty for that. They do encourage you to enroll in Medicare Part A. Medicare Part B can be deferred with no penalty as long as they have at least 20 employees. But other than that, if you have an employer group health plan whose coverage is as good as or better than Medicare, it is considered credible coverage. So therefore, you would, at the age of 65, sign up for Medicare Part A only and defer your Part B as in boy. And then once you decide you're going to retire, then there are 2 forms that have to be filled out. One that goes to your employer, which basically proves that you had creditable coverage. And then there's one that you fill out saying that you want Part B. Both of those forms together would prove that you had creditable coverage, and then that way you would not be charged a penalty. Is there another one? No other questions?
That's all I see right now.
Okay.
Is there another question?
So on the how do you enroll in Medicare Part A and B? So there's a couple of ways you can do that. Medicare Part A, you can enroll online at ssa.gov. Please, whatever you do, please make sure that it is ssa.gov, not ssa.org, ssa.com, any other thing besides .gov. If it's a governmental program, it needs to say .gov. So please remember that, because I've had people go on and try to get a social security card and use something else and call me and say, I paid for it. I paid for it. It's ssa.gov. So if you're going to put any information in, that's the way you're going to have to do it. You can also call Social Security, or you can make appointments through your local office. Now, right now, they are not making in-person appointments unless it's an immediate need. They will tell you, we will save your spot, and 6 to 8 weeks down the road, they will do a telephone call with you. So we always used to tell people Social Security will never call you in this situation. They are going to call you. Or else, I know I help people. I'm not for sure. I'm pretty sure most of the SHIIP counselors do help people sign up for Medicare Part A and Part B if they want to. But again, if you call Social Security, or if you make a trip over to Franklin, they're going to say, sorry, we can't do that in person. Let me make you a phone appointment. And they're going to give you one. Right now, they're about 6 to 8 weeks out. So they will call you. I'm going to call you at 10 o'clock on June the 1st, and at really close to 10 o'clock on June the 1st, they will call you back and go through the application with you. If you do it online through ssa.gov, it does want you to have a social security.gov account. If you don't make it through all the questions, it will allow you to continue with that.
We have a question, Denise.
Okay.
Will Social Security Administration meet with people in person who are hearing impaired, who may not be able to have a productive conversation on the phone?
I would think that they would, but that would need to be talked when you call Social Security in Franklin, or I think that's probably the closest for everybody here. You would just need to make sure that they knew that, and they would give them an in-person appointment. And I don't know how far out they are. The last one I made for somebody, it was about 3 weeks as an in-person. But if they just walked over there and tried to do it, or drove over there, not walked, but if they drove over there, they would more than likely schedule them an appointment for a later day. But I would definitely call first. And if somebody could call for them and just say that it's a hearing impaired, would they please do an in-person appointment? They would not have a problem doing that.
All right, thanks Denise for your part. We appreciate it. If you want to hear more from Denise, you got to call her.
I'll put my email stuff in the chat box, and if anybody has any questions after this, they're more than welcome to email me.
Super.
Thanks, Denise.
So I'm going to do the 4 parts of Medicare and supplements and advantage plans. So, and the important part of Medicare that we don't talk enough about is that you do not need anything other than Part A and Part B. You get bombarded on TV, by the mail and everything else that you got to have something else. You got to have something else. Well, that's not the truth. You could just have Part A and Part B. And if you don't get a Part D prescription plan, that's okay, but you will be penalized. But you're only required to have Part A and Part B, which Denise just talked about. I'm going to talk about supplements a little bit and the Advantage plans, and then Part D. So go ahead, Kelly, the next one. So you have a choice. You again just can have Part A and Part B. You can go to a supplement, decide to have a supplement with Part A and Part B and a prescription plan. Or you could go with an Advantage plan, which has a prescription plan built into it. And most do have that. With the supplement, you would certainly have to decide which supplement you want to have, and then include a prescription plan with that. And I'll go into depth into a little bit more of that. Go ahead, Kelly. So let's talk about a little bit, Part A, Part B, and the supplement. Supplements, there is a whole variety of supplements, and they're the more expensive thing that you could get. You have to remember, supplements work with Medicare and is taken anywhere that takes Medicare. So if you're a supplement, say if you have a Blue Cross Blue Shield supplement, when you go to the doctor, you present your Part A, Part B card, and then your supplement. You never have to worry about it. If they take Medicare, they're going to take your supplement, plain and simple. So you don't have to think about it at all. You hear about these stories saying, well, the hospital is having problems with Medicare or not Medicare, but having with Blue Cross or something like that. Well, that's only under Advantage plans. If you have a supplement, it works with Medicare and it's a blanket over Medicare, really. It'll take care of what Medicare doesn't. And again, such as the G plan is the most comprehensive plan on the market. It takes care of everything except for the $226 Part B deductible. Other than that, it takes care of everything that Medicare doesn't. So there's plenty of plans on the market. And another important piece to this is whatever supplement you go with, it is the same no matter who you do it with. The only difference is the price. You can get a plan for about $100 at 65, or you can get one for $250. It's going to do the same exact thing. You don't have to worry about that. So you don't maybe want the cheapest one, but you want something that you're comfortable with. The other thing about supplements, there's guaranteed issuance at 65. They have to take you no matter what your history has been. So if you've had a history of cancer or those kind of things. I had a gentleman that had cancer when he turned 65. Came in, got a supplement. It was taken care of, unfortunately, until he passed away about 6 months later. But they had to take him because he was within that 7-month open enrollment period. Now, for a supplement company, after that 7-month open enrollment period, they can tell you no. They can underwrite you and say, you know what, you have a history and we don't like you. And they can say, buzz off. So you got to be careful about that. And if you're really serious about a supplement, really looking at a supplement, it should be done right away when you turn 65. Because again, later on, there could be reasons why they don't take you. So if your health is possibly not so great, that's when you want to do it, is now, not later. We'll talk about prescription plans a little bit later. Go ahead, Kelly. So Part A, I should have had Denise do this, but Part A covers your inpatient hospital coverage, which has a $1,600 Part A deductible. When you go to the hospital, you're going to pay that. That isn't effective for 60 days. So say if you go to the hospital and you go in and you stay an hour, you're going to pay $1,600 deductible, no matter how long you stay in the hospital. And that is effective for 60 days. So say if you went back in the hospital within that 60 days, you're not going to pay that deductible again. But after that 60 days, you will pay it again. Under skilled nursing, meaning that you're going to go into a nursing facility 1 through 20 days, you're not going to pay anything. And 20 through 100, 21 through 100, you're going to pay $200 a day. It also includes home health.
Ron,
yes.
let's go back to skilled nursing.
Sure.
So skilled nursing is what we call nursing home. It is not assisted living.
It's rehab.
It is rehab.
Correct.
And it is not adult care.
No.
Medicare only covers skilled nursing in a nursing home for rehab, and you have to be progressing in rehab for Medicare to continue to cover the full 100 days.
And it's after a 3-day hospital stay.
And it's
Yes.
not for observation. They have to be admitted.
Yeah, that's another thing we have had is folks being admitted for under observation. So if your loved one or yourself is admitted and you or they will need rehab, make sure that you are admitted, not under observation, but admitted to the hospital for a 3-day stay, or you'll get to skilled nursing and they'll say, I'm sorry, your Medicare is not covering this stay.
That's correct. So it also covers, Part A covers home health and hospice and blood. Under Part B, there is again, like Denise said, it's $164.90 per month for your average person. If you're making more than $170,000 a year as a couple, you could be paying more. So not many of us are doing that, but that is a possibility. So Part B covers your outpatient hospital, physician services, outpatient surgery, durable medical equipment. So I have many times a person is going to a doctor appointment to maybe get a shot. They have some kind of disease and they need a shot at the doctor's office. And many times those shots are very expensive. So people always tell me, well, that must be a Part D cost. No, it is a Part B cost because it's being administered in a doctor's office. So it is a Part B cost and you'll pay it as a doctor visit rather than a whatever the cost of the medicine is. It also covers home health and preventative services. So Part B does have a $226 Part B deductible. And then after that, you pay 20%, Medicare pays 80%. Go ahead, Kelly. So, okay. What's not covered under original Medicare? Outpatient prescription medicines. My wife had a procedure at a hospital, went in for a procedure, and everything was covered because we had a supplement, but she takes prescriptions outside the hospital and they could not prescribe those. So that was a cost to us. Other than that, everything is covered. Routine dental, everybody talks about that. Because they see it on TV and they go, whoa, Medicare, when did they start covering dental? They don't, they plain don't. Routine vision and care and eye classes, again, they don't. Hearing aids, they don't cover. Foreign travel, cosmetic, if you want to look as good as I do, maybe you want some cosmetic surgery, but anyway, that again is not covered. Long-term care, again, as Sarah Jane just talked about, it is not covered. And although you still need your supplement or Advantage plan and so on. Go ahead, Kelly, or do we have a question?
Okay, okay.
Yeah, Pat has a big point there.
Yeah, there, Pat Buckner, thank you. Home health coverage is defined as skilled
Right,
services only. So this is only nursing and physical therapy.
right,
So again, home health coverage is defined as skilled.
right.
Nursing and physical therapy, no in-home aid as a standalone or aid service only needs other forms of paid coverage. So again, your home health covers nursing and physical therapy.
That's
Thank you,
correct.
Pat Buckner.
And that's usually after hospital stay as well.
Correct, yes.
Good point.
Go ahead, Kelly. So again, there's the card again. Go ahead, Kelly, another one. So that's hard to read and it only says what I just said, so continue on. And that's Part B, so we've talked about that. Supplements, again, there is a large range of supplements and they all do. Unfortunately, there's an A and a B, which confuses you even more. But G is the most popular right now. G is the most comprehensive. The only thing out of pocket with a G is a $226 Part B deductible. Other than that, if you go to the hospital, it's covered. Go to the doctor again, as long as it's Medicare approved, it will be covered under your Medicare and then goes on to the supplement and they will pay the rest. Again, supplements have, excuse me, have to cover everything. If Medicare sends them a bill, they have to cover it. plain and simple. There's no getting around it. It's required to do that.
So I have a question about that. There is a set fee that Medicare will pay for any given appointment or
Mhm.
any given procedure.
Mhm.
There may be an amount that the physician charges over and above the Medicaid agreed amount. Talk about that a
So
minute.
there's 15% amount that sometimes Medicare allows doctors to charge, and that is covered under the G plan. Only under the G plan. The other plans do not cover that. So it's called excess charges, and those are covered under the G. So yeah, sometimes specialist doctors and those kind of things are allowed to charge above. And charge would be covered under the G plan,
And if I don't have a G plan or a supplement,
then you will pay them.
Okay.
Go on, Kelly. Whoops, let's see, go ahead, next one. And you can see there's a variety of supplements there, and again, there's that piece where that says the Part B excess charges on there. The only one is checked as G. So again, there's a wide variety of plans. A G plan at 65 for a female is about $100. For a male, it's about $120. And they are all mostly attained age, meaning they're plain and simple just gonna go up as you get older. So be aware of that. There are some issued age plans which are based on when you buy the plan. And as you get older, it's not based on your age, but rather the economy and things like that. So, but that's issue age. And then AARP is a community rated. And that means they put everybody in a big pool. And if that pool gets sicker, then you're gonna pay higher prices. If the pool stays well, you're gonna do better. So again, there's really 3 different kinds of supplements that are available. Go ahead. So again, Advantage plans, we'll just hit on that for just a minute. Advantage plans, you actually, and I hate to use the word leave, but you leave Medicare and they furnish your health care for you. So you're still gonna pay the $164.90 a month. You're not gonna get away from that. But many of these plans are 0 premium. And they do have a little benefits, extra benefits like dental and vision. I stress to you, it's little. Because
it's very little.
yeah, very little. I had a person come in the office and they had a plan and they sent him to South Carolina for to see a dental for one of their dentists. Because you have to go to their dentist and their vision people wherever that is. And it could be anywhere, who knows? So be very careful about those bennies. I mean, they're kind of nice, but you gotta be very careful. Some plans actually pay part of your Part B premium. They will give that part back to you. They're not gonna give you the whole 164, but they may give you some money back. Gotta be careful of that because some have like a $500 healthcare deductible with that. So you're losing part of what you're gaining. So it's not helping you hardly any. So be very careful about that too. You're gonna pay, like I say, mostly the HMOs and PPOs we have in our region are gonna be, the HMO plain and simple means you're gonna have to go to their doctor or it doesn't pay. PPOs allow you to go to doctors outside the plan, but it's not gonna pay as well. And here's the kicker. O.J. Simpson, not O.J., but all those guys on TV don't tell you about this.
Jimmy Walker.
JJ, good old
JJ.
So JJ and the boys,
Joe Namath.
yeah, Joe, they don't give you this little tidbit. So before an HMO pays 100%, it ranges somewhere between $3,000 and $5,000 out of pocket before it pays 100%. Under a PPO is somewhere between $5,000 and $12,000 out of pocket before it pays 100%. So check the plan, be careful before you sign up. Because I had a person that they thought they'd go with a PPO Well, all their doctors were outside the plan and they were paying, their plan, the doctor inside the plan was gonna be zero. Outside the plan is $60 a visit. So it gets very expensive. It actually is more than what you'd pay under Medicare. So be very, very careful about those. There's plenty on the market. Any of us can help you with those. But, and there's a lot of agents that'll help you try to buy one. But again, be very cognizant. And the only problem with Advantage plans too is that your doctor could be in network this week and they do a contract and they're not in the network next week. So it could change during the year.
They also don't travel well.
No.
Yeah.
So if you're going to, say, if you like a doctor in Atlanta, Georgia for a specialty, well, under Medicare and the supplement, it would be paid for as long as they take Medicare. With an Advantage plan, there's a possibility that they don't take it there. So you have to be very aware of that too. So just, they make it sound really great and they are good. There's nothing wrong with them, but you have to be very aware of what you're doing. So go ahead, Kelly. Advantage plans, we already hit those. You can, open enrollment is October 15th to December 7th, and then there's a second open enrollment, January 1st to March 31st each year, that you can change your Advantage plan. Supplements, on the other hand, you can change those any day of the week throughout the year. There is no open enrollment. You can change them anytime.
If they'll take.
If they will take you. And I always tell people, don't drop your old plan until you got the new one. Because I have people do that and go, whoops, that was the wrong thing to do. Go ahead, Ken. Again, I've kind of covered those. I had a gentleman one time didn't have any reason to lie to me, I don't think. I asked, what's the difference between offering a supplement or Advantage plan either way? And they said supplements work great for sick people and Advantage plans work well for well people. Where does the line cross though? As you get older, you don't know. It's a gamble. Insurance is a gambling game. And so who knows when things are going to change. All right, Kelly. Go ahead. I'm going to hit one more time, Kelly. I'm going to really hit prescription plans for just a minute here. Just be aware, you can go to medicare.gov and look at your prescription plans. And you can do that. But we really do look at prescription plans. Everybody just says, hey, so-and-so has this plan, it's great, isn't it? Well, maybe it's not good for you. We want to make sure it covers all your prescriptions. And it may be the $4.20 plan on the market. It could be a $72 plan on the market. We want to make sure that it covers all your prescriptions. And it varies by prescriptions, by pharmacy, and again, by the cost of each plan. And so you gotta really look at that.
All individualized.
And individualized is correct. It all really is. Be aware there's donut holes. You hear about those all the time. Between 4,200 and 7,000 generally, that you will pay a little bit more for a name brand prescription. Generics are not so bad, but a name brand prescription. And so again, be careful when you're looking at a prescription plan. During open enrollment, it drives me crazy. These prescription plan companies, when they go from a plan for $33, the one plan went to $66 last year, and they had another plan on the market for $12.50, and it was same exact plan. They only changed the premium just to kind of so they could. So be aware of that. We can do during open enrollment. We do a lot of people. We take care of a lot of people, and so it's always good to look at your prescription plan each year, and you can do that for prescriptions October 15th to December 7th of each year.
We're very thankful it's no longer over the Christmas holiday.
Oh yeah.
It was to start. We do have a question, John.
Okay,
If you get an Advantage plan, can you drop it back to normal Medicare without being penalized?
that's correct. You can during open enrollment each year, so you will not be penalized. You can go back to part A and part B and pick up a supplement if you're well. And go that way, or and pick up a prescription plan. Most Advantage plans do have a prescription plan built into it, so you do need to pick up a prescription plan after you go back to part A and part B. So you won't be penalized.
But that's only during that open
Oh,
enrollment.
only during the open enrollment period. Right.
I actually did that. Many of you know, my husband has heart issues and he went on disability and he just turned 65 last year. And so the Advantage plan was the smart thing for us to do for a couple of years.
Right.
And as you can well imagine, he has quite a bit of prescriptions. We are in the donut hole as of April. But he now has a supplement because under the age of 65, the supplements are outrageously expensive.
Right.
And so those folks that have disability and then get Medicare, being able to access a supplement before you're 65 is very expensive. So we did the Advantage plan for a couple of years for him because that was the smarter choice at that point. And thank goodness he was relatively healthy, no hospital visits during those years. And then now he is under
Really
the original Medicare with a supplement and a Part D plan.
Right.
So, and also, I walked in, my mother was a retired state employee. So listen about your loved ones also. And she had good coverage as a retired state employee, but she heard from the man downstairs that Humana would do some wonderful things for her. And I walked in on a conversation with her trying to change her stuff. And I was able she did it. But because I was in the room and because I have these friends that are sitting here with me today, we were able to reverse it. But if all of those things had not lined up, we would have been in a potential world of hurt because she was making decisions with incorrect information about her. And that's the key in a lot of these situations.
So Allison is going to speak to us about extra help and SMP, which is Medicare Patrol. So we appreciate Allison being here too, and hit it up there, Allison.
Our extra help is a Part D assistance program, and it is actually run by Social Security, but we at SHIIP can help people enroll in Part D. What it does, it reduces or eliminates your monthly premiums, reduces your prescription drug costs, and provides an opportunity to change more often. You can change quarterly. It is an income and asset-based program. So your income and your asset must be below the standard that Social Security has set. But it's a great program. We enroll people. We would like to enroll everybody who's eligible for it. They do look at all your income. So we have people who come in who have not a whole lot of Social Security, but they may have a pension, and that puts them over, even though Social Security has sent them a letter saying, maybe you're eligible.
Yes, and we shake the trees for those
We do.
folks because if they qualify, we want them to have
We
it.
want them to have it. So they can change quarterly, 3 times a year, January through March, April through June, July through September. And then in that last quarter is open enrollment, which they can also change. But that gives them an opportunity. Say, for example, they are starting to take a new medicine that's very expensive. Their current plan doesn't cover it. We could change them to a plan that would cover it. So it's a great program. And we encourage anybody who thinks they're eligible to call us. Let us enroll them. All right, so the Medicare Savings Program is a Medicaid program, but what it does, it pays your Part B premium. So that amount of money goes back into your social security check. It also gives you all of the extra help benefits with your prescription drug coverage. You must apply with the Department of Social Services because it's one of their programs. And if you're on extra help, you're automatically eligible.
We have a concern about, or just expanded definition about tangible assets as
Okay.
it relates to, LIS, land, rental houses, the house they're living
All right,
in.
the house they're living in and their automobile are excluded from it. The property where their house is located, if it's all one tract of property, is excluded, be it an acre or 100 acres. Now, if they have another piece of property, say mama's house, that has to be counted. The rest of the things, stocks, bonds, IRAs, any kind of investments like that are considered assets.
Thank you, ma'am. And we have a follow-up, transferring these assets. And a time frame for transferring these assets.
Social Security is the one who sets those guidelines, and they do not share them with us.
Okay,
So I don't know about, for extra help. Now, Medicaid has very strict requirements for assets, and you would need to check with Medicaid.
Cause that could certainly change
They
the whole makeup of
Could
the
make a big difference if you've transferred
property.
property.
right, like, for example, and we'll go into this more next week with Medicaid as it relates to long-term care. But in Medicaid for long-term care, not to confuse anybody, but there's a 7-year look back for that. So they could be similar guidelines or similar criteria
Yes.
for a look back for these other programs as well.
Not have much experience with extra help turning people down because of assets. It's usually, we usually look at their liquid assets, a bank account or something, and the amount, you know, is rather high. It's $16,000.
Yeah.
So that's quite a bit to have in a retirement account or having in the bank.
Yeah, my mother, again, going back to her, she qualified for LIS.
Mhm.
And it was a great help to her, for
Exactly.
sure.
It does make a big difference because normally people with extra help are not gonna pay probably less than $10 for a prescription. Where Eliquis is sometimes as much as 500, so it could be a big difference.
It was a huge help to her.
You have anything else?
Not until we go with this other.
Go ahead.
All right, so let me talk about the Senior Medicare Patrol.
Yeah, go ahead.
Go ahead, Kelly.
We're not-
There you go, right there.
All right. The Senior Medicare Patrol is a program under the Department of Insurance that is focused on Medicare abuse. So there has been abuse in Medicare where doctors or companies have bought scooters for people that were not covered and so on. So what we encourage people to do is to look at their Medicare summary notices and get a Medicare summary notice every quarter. People on private insurance know those as EOBs, explanation of benefit, but Medicare calls them Medicare summary notices. It lists every charge that has been placed against Medicare. And if you see something for a doctor you didn't go to, you need to report that. Because it could be a scam for you. Now, word of caution, if you go and have some kind of radiological test done, you know your doctor, you know your hospital, you don't necessarily know the name of the person who reads that radiology thing, but if it is on the same date and close, then you can assume it's okay. if you have some kind of surgery and you have some pathology done, you don't know the name of that pathologist who looks at that sample. But here again, the same applies. If it's around the date where you went, it's okay. But if it's somebody you never heard of and it's a week you didn't go to the doctor, you need to pay attention to that. And those are reported. We as SHIIP counselors can look at that for you, but they really need to be reported to the Senior Medicare Patrol, which is within the Department of Insurance.
I had a gentleman just last week come in and he was getting diabetic supplies for the last 6 months. He's not diabetic, and he never received those items in the mail. And so we filed a report with Medicare and the state. So
And
those are
it also can be a coding issue,
Yes,
just
true.
an easy,
true.
non-intentional coding mistake. I always use the example Mary Barker used to use of the 82-year-old woman who got charged for a pregnancy test. 2 numbers got flipped, and she did have some tests, but not a pregnancy test. And so she caught that, and you know, that was taken care of. It was just a simple mistake. But I also want to say about SMP, and Kelly, maybe she may have come on to say this, but here at Southwestern Commission Area Agency on Aging, we can provide a senior Medicare patrol to anyone in the region. Any civic group, church group. We do it at senior centers. Kelly's been doing it at a couple of places, particularly here recently. So we're happy to offer that program to folks if they want it.
The word is that $68 billion is lost each year to Medicare fraud.
Yeah.
So you need to protect yourself. You need to look for those errors, and you need to report it.
That is our presentation for the day. We appreciate your time, Sir Jane, and
Thank you. That was awesome. Thank you. Thank you. Y'all did a great job. We appreciate you very, very much. And I hope that you all got some good information for you. Are there any last questions that folks may have? All right, seeing none. Kelly, have you take it away?
Yeah. So, oh, and we do have one question. Are we able to get a copy of the slides? Yeah, as long as our presenters are fine with that, yeah, we can send that out. And we will do that. I will make a note to do that. Yeah, so after each of our sessions, we pick a door prize winner. So today, before we started, I picked number 17, and number 17 on my screen was Jim Branscombe. Believe he's still on. I haven't checked, but if so, congratulations, Jim. You are the winner today.
Awesome.
Congratulations. And you have won a
box.
bamboo salad bowl set. So,
Wow.
and a cutting board.
Eat healthy.
Good deal. All right.
Well, veggie time, that'll be nice.
Could you repeat the presenter's names and workplace names as those?
And we will need his address so we can send it to him.
Yeah, we will need your address.
So, my name again is John Chicoine. If you need the spelling, I'm not gonna give it to you. No. CHI.
Here.
Oh, you're
Hold
gonna
on.
put it in.
Hold on.
Okay.
It's too.
Okay. You put it in there.
All right, spell it.
CHICOINE.
See, that's why. There you go.
And put Allison.
He is at the Senior Resource Center. Oh, sorry. In Waynesville. Yeah, I thought so. DSS. And And then Allison Woodard. And she's Swain County.
If you will, give that.
At the
Cooperative extension.
cooperative extension.
Want the phone number?
Sure.
488-3848.
3848. And as, before we end, y'all know how much you all saved, folks, last year? Off the top of your- Or close?
350,000 for Haywood County.
I think I saved 150,000.
Denise?
Ours was right at like $280,000 for Cherokee County.
That's amazing.
Mhm.
That's amazing. The amount that, our folks save older adults in our
Good, how are
region
you?
is,
Oh, and I don't,
thank you, Kelly. The amount that our folks save in the region is more than the program costs. Did I say that right?
Exactly correct.
Yeah.
Yep.
The amount that our folks save, older adults in the region or anyone on Medicare, is more than the program costs nationally. Which is amazing. It's absolutely, and it's been on the chopping block a couple of times on the federal government side. So remember that if you see it on the chopping block, how important it is and what a wonderful resource it is.
And we can save a lot of money. We saved one guy $65,000 because a very expensive brand name drug he was taking was no longer going to be covered by his current plan. We changed plans and found one that covered it.
Right. Right.
Sarah, I'm sure that John and Allison feel the same way, but we do it all the time. So we're used to this, but there is never a crazy question with Medicare. And if there's something that comes up, please reach out to one of us, or you have counselors in every county has a counselor. We are more than happy. If we can't find the answers, we've got people in Raleigh. And I know I've reached out to them with things before, and that's what we're here to do, is to help. And that's what we're all passionate about. I know John and Allison are the same way, but it's just that if we can help one person, it's worth everything that we do. So don't ever feel like there's a crazy question, or if you get something you don't understand, please reach out to us. And again, if we don't know the answer, and we're not going to know everything, but we do have people that we can reach out to that are more than willing to help. So
And
it's. Mhm.
Yeah, I have two things. One is you have a SHIIP counselor in every county.
Mhm.
That is amazing and wonderful. And if you don't know who that is, reach out to us and we will direct you to the right place. And then I forgot what the other thing is. So Allison,
Around. Not
Available
just
year-round.
during open enrollment. We're there all the time.
right.
We're there waiting for your call.
Yeah, and I draw your attention to the chat. We're gonna be posting the taping of our spring conference sessions on our website. They aren't there yet, but that's where you can access them going forward, or if you have other folks who need to gain this information in the future. Anything else anybody has? Have I forgotten anything?
No, I think you got it.
All right, we appreciate you all. We will see you next week as Michelle Spry and Misty Cooley give us some information about Medicaid as it relates to long-term care. Have a great rest of your week. Bye-bye.